A patient tells you, my hamstrings are ridiculously tight, my shoulders are full of knots, and my back is so tight that something must be pulling it out of place. And very often they have already decided what needs to happen next. It needs stretching, releasing, loosening, or perhaps somebody needs to get an elbow into it and really break through that tension. But what does it actually mean when somebody says a muscle feels tight? Does it mean that the muscle has physically shortened? Does it mean that the tissue has become stiff? Or could the sensation of tightness sometimes be part of the nervous system attempting to protect the area? In this video, we're going to look at why feeling tight, having restricted movement, and having a physically shortened muscle are not necessarily the same thing. We'll also look at how we can explain that to patients without dismissing what they are genuinely feeling. I'm Jen Summers. I work across massage rehabilitation and coaching, and I'm currently studying sports injury rehabilitation. This video is for rehabilitation and healthcare professionals, therapists, coaches, and students who want to have better conversations about pain and movement. Let's begin with an important distinction. Tightness is often a sensation. It is something the person feels. They may describe pulling, tension, pressure, stiffness, restriction, or the feeling that the muscle will not let go. That sensation is completely real, but the sensation alone does not tell us exactly what is happening within the tissue. A person can feel extremely tight while having a normal range of movement. Another person may have restricted movement without describing any tightness at all. And somebody may gain more range immediately after stretching, massage, warming up, or simply just changing position. That immediate change does not necessarily mean that we have physically lengthened a muscle within the space of a few minutes. It may mean that the person is now just more comfortable moving forward. The sensation has changed. Their tolerance of the movement has changed. The nervous system may be allowing access to a range that it was previously just reluctant to use. That does not mean tissue properties are irrelevant. There are situations where structural restriction genuinely matters. A person may develop a contracture after prolonged immobilization, and there may be changes following surgery, neurological injury, or just significant scarring. An acutely injured or irritated tissue may also need appropriate protection while it heals. We should not replace the belief that every tight muscle is shortened with the equally rigid belief that tissue length never matters. The point is that we cannot reliably diagnose a physically shortened muscle simply because someone says it feels tight. We need to assess the bigger picture. One useful question is, does the restriction behave like a structural limitation, or does it change? Does the range improve when the person is warm? Does it change when they feel supported? Can they move further when they control the movement themselves? And does the restriction vary depending on speed, position, load, or confidence? Is it worse following poor sleep, stress, painful flare-ups, or a previously frightening experience? If the available movement changes noticeably according to that situation, that gives us information. It suggests that the nervous system may be influencing how much movement currently feels acceptable. The brain and nervous system are constantly making decisions about movement. They're not simply waiting for a muscle to reach its physical limit. They use information from all around the body, but it also uses previous experience, expectations, and the current situation to decide the course of action. If a movement has previously caused pain, the system may become more cautious about that movement. Muscle activity may increase. Movement may become slower or more guarded. The person may stop before they even reach what they are physically capable of accessing. And that is a protective response. Protection is not automatically a problem. After an acute injury, limiting movement can be pretty useful. The problem is that the protective response can sometimes continue after the immediate need for protection has reduced. The person may then experience the protection itself as tightness. And this is why I'm cautious about telling every patient that the answer is, let's get stretching. It's not that stretching is inherently bad. It can feel quite pleasant and it can temporarily improve range of movement. It can form a useful part of a warm-up or rehabilitation program, and some people just genuinely enjoy it, and that matters too. But stretching is not automatically required every time something feels tight, and more aggressive stretching is not necessarily better. If the nervous system is already treating a movement as threatening, repeatedly forcing it into a strong, painful stretch may actually provide more evidence that the position is dangerous. The patient may temporarily gain some range, but continue to feel that the area needs constant stretching, releasing, or correcting. The treatment may then reinforce the belief that the body cannot manage without regular intervention. A more useful question might be, what would help this person feel safer, stronger, and more confident within this range? That could include gentle stretching, but it could also involve slow movement, strengthening, graded exposure, breathing, changing the position, reducing the load, or just simply giving the person time to explore the movement without forcing it. Let's look at how this conversation might sound with a patient. So if we imagine that they say, my hamstrings are so short, I stretch them every day, but they immediately tighten back up again. We could respond with, they certainly feel tight to you, and I can see why you would feel restricted when you're trying to reach forward. One possibility is that the muscle is physically shortened, but that isn't the only reason a muscle can feel tight. Sometimes the nervous system limits a movement because it's trying to protect the area. The fact that the range changes after you warm up or after we alter position suggests that at least part of this may be adaptable rather than permanently fixed. That acknowledges where the patient feels without immediately confirming that the muscles are structurally too short. You might then add, instead of repeatedly fighting the tightness, we can explore what helps your body becomes more comfortable in that position. We may still use some stretching, but we might also build strength and control through the range so that it begins to feel more familiar and less frightening. The language matters here. I would avoid saying your hamstrings aren't actually tight. Even if we mean that the tissue is not physically shortened, the patient can clearly feel tightness. Telling them that they are not tight creates an unnecessary argument. I would also avoid confidently declaring, it's just your nervous system protecting you. The nervous system is always involved in sensation and movement, but we still need to assess the individual rather than replacing one simplistic explanation with another. A better phrase is, the feeling of tightness can sometimes reflect protection or sensitivity rather than simply telling us that the muscle is physically too short. That keeps explanations open and accurate. Another common example is a patient who says, my neck and shoulders are full of knots and they need releasing. Again, it may feel reassuring to tell them that we can break up the knots and loosen the tissue. They may also experience genuine short-term relief from massage, but we should be careful about the story we attach to that relief. Massage may change sensation. It may help the person relax. It may make movement feel easier, and it can reduce the perceived threat around the area, and they're all valuable outcomes. We don't need to tell someone that we have broken down scar tissue, removed toxins, or physically forced a muscle back into place to justify why they feel better. We can just say, the treatment may help settle the sensitivity and make the area more comfortable to move. The next step is to build on that change so you become less reliant on somebody else repeatedly releasing it. That changes the role of hands-on treatment, and it can become something that may support movement and confidence rather than something required to correct a faulty body. There is also a wider behavioural issue. If somebody believes every tight sensation means a muscle is becoming shorter, stuck, or damaged, they may become increasingly vigilant. They check it, they stretch it, they foam roll it, they repeatedly compare one side with the other, and every time the sensation returns, it feels like evidence that the treatment has worn off and that the problem has now returned. But bodies do not remain in one fixed state throughout the day, and sensation changes, movement changes. Muscle activity changes, sleep, stress, activity, fatigue, and context can all influence how the body feels. Variation does not automatically mean deterioration. That can be incredibly useful message for patients. The aim is not to persuade them that stretching is pointless. It is to give them more options. Instead of, it feels tight, so I must stretch it, we can move towards, it feels tight today, let's explore what it responds to. Perhaps it responds to movement, perhaps it responds to strengthening, perhaps it responds to reducing demand temporarily. Perhaps it responds to feeling more supported or confident, and maybe stretching is useful but does not need to be painful or aggressive. That is a far more flexible and empowering approach than treating every tight sensation as evidence of a shortened or faulty tissue. So the key points from this video are: tightness is often a genuine sensation, but it's not a diagnosis. Restricted range does not automatically prove that a muscle is physically shortened. The nervous system may sometimes limit movement as part of a protective response. Stretching can be useful, but an immediate increase in range does not necessarily mean that the tissue has been permanently lengthened. And when we explain tightness to patients, we should validate what they feel while offering a broader and less threatening interpretation. In the next video, we are going to bring these ideas together and look at one of the biggest mistakes clinicians can make when explaining pain, trying to correct the patient before they feel understood. We will look at why simply saying your scan is normal, nothing is damaged, or it's all in your brain can cause us to lose the patient's trust, and how to introduce pain science in a way that feels collaborative rather than dismissive. You can watch that video using the link on screen or in the description. And if you are a rehabilitation or healthcare professional who wants to understand pain more deeply and explain it more confidently, you will also find the details of my full online pain course below.